Hi, it's Julie, the Oncology NP. I just was on live a little while ago and had a really great question about Signatera testing that I didn't have time to answer. So, you may or may not have heard of Signatera. It is a ctDNA test, meaning CT meaning circulating tumor DNA. And what this test does is look for the DNA of cancer cells in the bloodstream. This isn't a test that everybody gets, although certainly it's becoming more and more popular as clinicians and patients, honestly, are learning more about it. And it's a test, it's not like necessarily a one-time test. What that does is it looks for the DNA of cancer cells in your bloodstream. Now, when somebody is diagnosed with a solid tumor and the Signatera test is ordered, they take a sample of the cancer and then a sample of blood and basically send it off to their lab and match it up. Then over time, they can continue to draw that blood test and see if there's any cancer cells remaining. It's really, really exciting technology, but unfortunately, there is still a bit of an unknown about it in that what do you do when a ctDNA test comes back positive, but no cancer is seen on a test? And as of right now, most oncologists probably would not do anything different than continue to watch and observe. So just because a ctDNA test is positive does not mean that there is visible cancer on a scan. And that is typically what is used to go ahead and start treating that disease. So if a scan does not show any active disease, they may just continue to wait. So for some people, this is absolutely not an option because their anxiety will not let them handle that or live with that. But then for others, they really like to know and they just feel a lot better when they get that negative test back. So definitely talk to your oncologist and see if that's something that is recommended for you.